Hi, I'm Dr. Beavers, and I want to spend a few minutes speaking with you about osteoarthritis. Osteoarthritis affects millions of Americans every year. It can cause a great deal of pain, and it can limit a person's lifestyle greatly. Now, osteoarthritis is known by many names: degenerative joint disease, degenerative disc disease, spondylosis, spondylitis, and sometimes referred to as old age arthritis or wear and tear arthritis. Now, in our office, we use the term degeneration. One of the reasons we use the term degeneration is that it is a different condition in the patient's mind. You see, we're told that osteoarthritis is this condition that we just get and that we have to live with and can be limiting, and there's no real treatment besides powerful anti-inflammatory or pain medications, which, by the way, can be very addictive. Now, we know that modern science tells us that that's not true. There are many things that can be done to help patients suffering with osteoarthritis, especially of the neck and the back. You see, osteoarthritis left unchecked and developing in the worst cases causes slippage between the vertebrae, impingement of the nerves, loss of mobility, flexibility, and can ultimately cause spinal stenosis, which can cause an impingement of not only the spinal nerves, but the spinal cord itself. Now, in our office, we use a variety of techniques. The first step, however, though, is to sit down and take a thorough history with our patients and find out what the root of their injury may be from, caused from, or if there's a factor of their lifestyle that's continuing to worsen their condition. The second step is a thorough orthopedic and neurologic evaluation. Many times that includes about 60 different tests of the neck, back, and spine, completes in a complete orthopedic panel and a complete neurologic evaluation. In the case of osteoarthritis, many times it's necessary to x-ray the affected area as well. We use a series of very precise measurements and biomechanical analysis to determine if a patient can be helped. One of the major problems with osteoarthritis is that it limits the motion in a patient's mobility. And in turn, that loss of motion and mobility worsens the condition of osteoarthritis. You see, in the spine there are discs, which are these shock-absorbing, water-filled cartilaginous tissues, very much like a very tough sponge that fits in between the two bones. And when a spine becomes subluxated, or when there's a loss of motion to the neck and back, those discs stop taking fluid in and out, very much like a sponge in the dish pan at home. If you took a sponge and you wrung it out and you put it back in, it would soak up water again. Well, that's how the process of osmosis works in the neck and the back. Those spinal discs are pulling water in and out of the surrounding tissues all day long. But when the spine stops moving and that disc stops moving, it stops bringing fluid in and out, and that disc starts to dry out. And as it dries out, it loses height, it loses flexibility, and starts a process of breakdown or degeneration. And that's one of the reasons why people say, I have a degenerated disc, or I was told I have a degenerated disc. Now, we know that restoring the normal motion of the spine helps those cartilaginous surfaces lubricate again and begin to pull fluid, water, and oxygen back into the disc and push out waste materials, and helps our patients who suffer with osteoarthritis, or as we call it in our office, degeneration, function much, much better. It is an excellent source of pain relief and an excellent way to return the normal function of the spine and ultimately our patients' lifestyles.